With me is Les Greenberg. He is the developer of emotion-focused therapy, evidence-based experiential humanistic therapy that's now practiced and researched worldwide, putting emotion at the center of human experience. And after decades of research into emotion processes, your work has come to influence clinicians from all theoretical backgrounds. So I'm very happy to have this chance. Thank you, Les.
Good.
Well, just as there was a cognitive revolution in the 60s and 70s, it seems like in the last decades there was a sort of emotion revolution, particularly in the field of psychotherapy. Can you tell us what you think might have contributed to this?
Well, I do think there's a sea change, right, going on with emotion. I'm still not sure there's a quite the same revolution going on in psychotherapy, right? Because there's still such a strong dominance of cognitive behavioral therapy. But certainly everyone is embracing emotion. And I think there have been two main factors. One has been all the neuroscience demonstration of the actual validity of emotion, and that emotion is really a phenomenon unto itself. And then I think somewhat the failure of cognitive therapy to be as effective as it promised. And so, people keep looking for more effective methods and so on. But, it is a bit of an enigma. It's a puzzle, right? Because, of course, psychotherapy has been about emotions from the beginning. So why exactly now it's happened? But as I say, I think the main thing is the sort of more hard science, the more experimental science study of emotion, making it a more respectable kind of phenomenon worth studying, and then fMRIs and things like that.
And your work definitely helped also to change this in a way, I think. And
yeah, I hope so. I believe so. That's true.
Yeah, I think that's quite true. And at the same time, you mentioned cognitive therapy. It's interesting because I see more and more cognitive therapists embracing emotional processes and the so-called third wave movement, and even more dynamic oriented therapies like 𝗔𝗹𝗃𝗅 with ADP. So there seems to be a growth in the interest of emotion.
Yes, I agree.
So, well, you've worked with emotion forever, and you've written that every emotion, in every emotion there is embedded a need, and that emotions are really goal directed. Well, after having worked your whole life with emotions, what do you think are the core needs that human beings have, and how do you think we differ, or do you think we differ a lot in terms of needs?
Well, I'm quite sort of, I have a reaction to that question, because I think it puts needs as central. It's a motivational perspective. And I've been in the last years writing against this view that we need to think about central needs, because I think needs are constructed from emotions. So I think, it's contrary to what a lot of people believe, but like an attachment motive, a need to be connected, and a need for achievement, a need for identity, validation. But I think that, I certainly, when I started as a young student, would look at what are the basic needs and all this kind of thing. And also it's basic in psychodynamic therapy to look at the motivation. But what I'm saying is you wouldn't have attachment if you didn't have emotion. You wouldn't have achievement if you wouldn't have emotion. So that I think needs are constructed out of emotion. And so needs are a secondary phenomenon, not the primary phenomenon, right? And if something really feels good and it suits the organism, then the organism develops a need for more of that.
Uh-huh.
And that's so what we have basically is anger, sadness, fear, shame. And I think that's the fundamental question.
Okay, yeah. And from that derives a need. That's what
Right.
yeah. It's interesting because actually I think you're quite right. Usually we think it the other way around.
Right.
So you're making the case that the primary process is always the emotion and the need comes after that.
Yeah, yeah.
Okay.
And the need is constructed from the, from life experience.
Yeah.
Then the question of what are basic needs, I mean, they do seem to be certain tendencies, right? But they're shaped and formed by experience. And so, there's a tendency to need other human contact, and there's a tendency towards mastery or effectiveness.
Mm-hmm.
That's what I think. But the basic tendency is to survive.
Mm-hmm. Well, you came to see psychological disorders as largely problems of emotional regulation. Can you elaborate on this?
Well, I'm not sure that I would say emotion regulation.
Tell me, yeah.
Because that tends to imply that the emotions are dysregulated.
Uh-huh.
This is the dominant cognitive behavioral view, that things are basically problems of emotion regulation, which implies that there's too much emotion going on and you need to regulate it. So people like Barlow in the Unified Protocol, I mean, basically they see that you have dysregulated emotion and you can't regulate it. So I don't see that as the problem. Mm-hmm. I see the problem much more as that we have emotion schematic memories that are painful, and that it's our avoidance of emotion that's the main problem. So it depends how the word regulation is.
Yeah.
Right? But I see avoidance of emotion, probably interruption of emotion, the meanings we create from emotion as being the problem, not that we have too much emotion that we can't control.
Mm-hmm. Okay, and too little emotion?
Yes, and that we have too little emotion because we're avoiding or dreading it, right? Yeah. So I don't quite know. I've reacted to both.
Uh-huh.
It's about need, and I don't quite know what you meant by regulation, but I was reacting to that.
Yeah, well, actually, I thought, probably maybe wrongly, that I was following the idea. I didn't just think of down-regulating emotion, which I think is also quite cognitive in its nature, but both ways, like the importance of knowing how to take the emotion, express it in a way that's constructive, simulate the adaptive meaning to it.
Right. And that is, and I think that's better referred to as problems in emotional processing.
Okay.
Rather than emotional regulation.
Okay. Well, there is a very helpful dialectic that you use when you talk about psychotherapy that I like a lot, about the leading and following the client.
Right.
And I wonder if you could tell us a little bit about the importance of this and how you try to integrate these polarities.
Yeah, and it was a very difficult integration in my own development because I was trained initially as a client-centered therapist, and then as a Gestalt therapist, and then as a systemic therapist. When I started doing more couples therapy, I was naturally more directive. And in Gestalt therapy, it was more directive in process, although I didn't say it was theoretically. So there was a tension between my client-centered following and my Gestalt therapy suggesting experiments and doing things. And I struggled with that for many years. And then in the end, it seemed to me that rather than the one being right and the other being bad, that actually it's an issue of when do you do which. That is the real thing. So I do think that that's really one of the most fundamental aspects of what EFT has contributed, and I'm pleased you actually picked that up, as a question. I like to talk about it as a one-note tune. You understand, right?
Sure.
Is a very simple tune, right? And then in a complex human interaction, anything that says you should be totally non-directive or you should follow the manual and do it doesn't account for the complexity of essentially responsivity, right? That you need to be responding to the moment. And that means sometimes you follow and sometimes you lead. And then you get a much more complex description of what goes on between human beings.
Yeah, from what you're saying, like my immediate reaction, it reminds me that it logically derives from that, the marker-guided interventions you use.
Correct, absolutely, right.
Could you talk a little bit about that? What the importance of having markers?
Yeah, so I think, that was the other big innovation, that it seemed to me like when I was a graduate student, we used to ask the question of how do people change? And it was like, is it through insight or behavior change or experience? But then when I started studying the processes, I saw that people changed in different ways at different times. And then we used to ask, how do you intervene? But then it became clear that it was, at what point do you intervene in this way? Again, it was just a more differentiated way of describing the territory. So that it seemed to me this idea, we started with when, then events. Right? When the client is in this state, then this is a good thing to do. Right? But it's all got to do with being responsive to the state that the person is in.
Yeah. It reminded me also while we were talking, I remember you writing that when you went to 𝗵𝗍𝗍𝗍, to the Society of Psychotherapy Integration, it was kind of an intellectual avalanche for you. Because suddenly there are so many different ways to see how to react to the person in front of you. So I imagine this gave you even more to think about when to do what.
Yes, right.
Well, when it comes to good emotional work in psychotherapy, can you tell us why sometimes the way out is through?
Well, I think that has to do with the fact that one of the fundamental difficulties is people are protecting themselves from their emotions for fear that they won't be able to handle it. So we talk about self-interruption or avoidance, or so that the things you have to help people face their painful emotions. And they're very painful, so people feel the emotions will destroy them. And I don't think it's a matter of not knowing. So there's not repressed unconscious material. There's disowned or disclaimed experience. I mean, I know that, a person would be, I know that I feel shame, but I don't want to feel it.
Yeah.
So then it's like you have to help people face the dreaded feeling and find out that they survive it, essentially, and then extract the information from it and make it amenable to transformation. I mean, one of the statements I make is you have to feel something in order to heal, or you can't leave a place until you've arrived at it. So, I mean, to change an emotion, you have to feel the emotion. Then you, in my view, need to feel another emotion to change that emotion.
Yeah, you've talked about emotional change with another emotion. Yeah.
Right.
Sorry, I interrupted you.
No, you didn't.
I was thinking that, what you're saying also connects to me with psychotherapy, the psychotherapist himself, psychotherapy training. Because I was thinking that, well, we're all human and we all have maybe this emotional avoidance tendency. And I can imagine that for a therapist, if they have also the degree to which they have this must probably reflect on their capacity to experience, process, bring in emotion in the session.
Yes.
So I'd like to ask you about the importance of experiential work on part of the therapist. I know that EFT has for some time, given importance to empathy training and the sort. So could you tell us a little bit about this?
Yeah, I mean, I think the personal work and experiential learning is the way to really learn how to work with emotion. So you have to be aware of and somehow be able to deal with your own emotions. Now, this doesn't mean you have to be super healthy but you've got to experience. The thing I'm thinking of is, an emotion-focused therapist might still have fear of their own emotion, but they have worked with it. They are aware of their fear, and that helps them to be more sensitive to the fear in clients. So I'm not proposing like the sort of super healthy therapist that are all sorted out, but they have to be comfortable with dealing with their emotions or be aware of their own discomfort of dealing with emotions, and that will help them. So yeah, it involves a lot of personal work. So our training involves people actually working on themselves and working with their own emotions, because you can't really take someone into their painful emotions if you believe it's going to kill you.
Yeah. Sure.
And you have to have gone through facing your own painful emotions and found out that in fact it helps. It helps alleviate it, or you could get through it. That gives you the confidence to be with people in their emotions. And then there's a gender issue as well. Men are much more uncomfortable with their emotions in the Western, the Latino cultures are slightly different. But in many of in my view, I don't know that this is absolutely true, but, there's a lot of machismo in the certain Latino cultures, but it promotes secondary emotion, not necessarily facing the painful emotion. But there's much more comfort with expressing anger and tears. But I don't know that that's facing really the core emotion. So, but in general, it's a known fact that there's a gender difference between man and woman in comfortableness with emotion. So male therapists have to work harder. And I had to work hard, to come to acknowledge my emotion, because I tried to control my world rationally. I used to be an engineer. I was very mathematical and rational. So I think that's another issue in the sort of training of therapists, that men have to really get inducted into that emotions are actually intelligent information.
Yeah. I was thinking that maybe the appeal of another side of the field of psychotherapy, for instance, manualized treatments and certain types of therapy, could also be a symptom, in a way, of this emotional avoidance.
Yeah, I believe it is.
Okay. Well, you have... well, I wanted to ask you something first. Well, just to connect this idea of the therapists themselves, if you're in therapy, how would you describe your ideal therapist?
Interesting question. I'd want them to be emotionally attuned, accepting and non-judgmental, and not simply a nice person, but to have depth and wisdom about life and living. And it's hard to capture. I want to say I'd like them to be a little bit challenging, but I'm wary. I don't believe in confrontation, or I wouldn't like somebody, but challenging by guiding me to places that are more difficult or complex, and I think I'd want a therapist who keeps me on the leading edge of my experience, right? So it's like looking for what isn't yet articulated.
Mm-hmm. I remember I read that you did a 3-year analysis, I think. And
yes, it's 2 years.
2 years. And I remember that time you wrote exactly about this, that you felt the good part of the emotional attunement, but it lacked a little bit that edge that you're speaking about. So,
Yes, absolutely right.
So maybe you're saying that the therapist would need to be able to lead and to follow.
Exactly. That is what I was. That was what I heard myself saying. Yes.
Okay. Okay.
Exactly.
Well, you have written about ways of being and ways of doing in psychotherapy, and you noted that the being skills are much harder to train. It's what we've been talking about. For instance, training in empathy, which you have done, is harder, I imagine, than applying a certain technique.
Sorry, I didn't quite hear that.
Yeah.
It's more than applying a technique. Is that what you said?
That it's more, sure, and it's harder than just applying a technique. Yeah.
Yes.
Does EFT suggest ways to better train therapists in those being skills?
Well, actually, it's something that we didn't do initially because the focus was so much on emotion and learning the different tasks. But now there's a real movement towards focusing on training in those skills. And recently, there was a book with 𝗔𝗹𝗲𝗅 on therapeutic presence.
Mm-hmm.
And that's sort of to highlight the importance of that aspect. And so now in training, we're starting to try to develop ways of helping people train to be responsive and attuned to the moment and so on.
Mm-hmm.
I mean, that's still not a training in ways of being in the world, but it's training on how to be present and open and responsive in the therapy session.
Unfortunately, I think, in my biased view, that academia and colleges usually favor book-based knowledge.
Exactly, right. So at the end of that presence book, we suggest that all psychology training programs include training people in being present.
Yeah. Mm-hmm. Do you see videotaping and videotaping your own sessions as an important part, or possibly important part?
Well, I see that as an important part in learning to be attuned and responsive. Yeah, it's not so much to being present in the moment, but it's a little bit more on the technical side, to sort of really learn how this kind of intervention impacts the next moment. It increases your perceptual skills.
Yeah. Do you ever have a conflict between the being less and the doing less in therapy?
No.
You don't feel that?
No. I think maybe early on I did, but that was a conflict of values or idea, sort of...
what you were speaking earlier from the client center and Gestalt.
Right. But no, it flows synergistically.
I wish we could all say that.
But if you think about a normal relationship, not a therapy relationship, you're not monitoring if you're listening or if you're responding.
Yeah.
It just flows, right?
Yeah.
Which should, if you're not too anxious and so on. So it's natural.
Well, you had a chapter in the book How Therapists Change, where you told your story of your personal development as a psychologist. And I've always loved the title of that text. You said, From Uncertainty Through Chaos to Complexity. I really love that title. Do you think that this might be a path that most of us have to go through in order to achieve a certain level of expertise?
Yeah, I think so. I do think that's probably a path, yeah. So I was making a point, in the title too, and that really is the point, I mean, there was a theory once, I will also, I'm forgetting his name right now, at my age,
Sure,
Kurt Lewin, or Levine, unfreezing and refreezing. But I mean, that change. But when you start off, you have a sort of set of ideas, but you're not confident.
Yeah.
And then you've got to take in a lot of input and sort of get all chaotic and then reintegrate, but now at a much more complex level.
I can imagine you've seen this not only in yourself, but also in your students.
Yes. Right.
They go through quite a bit of chaos, I imagine.
Yeah.
You've worked with intense emotions for many decades now. Is there ever a fear of habituation or burnout? Do you have to consciously work yourself at it?
Personally, no.
Okay.
But the issue is, I'm an academic and a researcher, so I don't see 25 clients a week.
Yeah.
So I think that's a different context and also the kind of clients. But, usually, I mean, the way I like to talk about it is that on a Friday afternoon at 3:00, if I'm sitting with a client and they're just talking, then I feel like I want to fall asleep, right? but if they're in their emotions and I'm helping them deal with painful material, I'm very alive and awake.
Yeah.
So I actually find sharing people's struggles revitalizing.
Yeah.
Because it's a sort of I-thou relationship of great contact, and that's usually life-giving, not life-draining.
So it brings aliveness.
Yeah. But that's when you're really in people's emotion, and it's, if people are very blocked or are very dysregulated, traumatized, that is more demanding. But I think as you get more comfortable with emotion, it's not that energy draining. When people start off working with emotion, it's frightening to them. So it takes a lot of emotional, it's stressful at some level, but afterwards it's not stressful, I think.
In a way, it's a question of experience, no? Again, you go through this teaching yourself that you can go through all this emotional work and not destroy yourself.
Yes.
So it gets better. I actually, you were talking now, and I also remembered that you wrote in the emotion-focused therapy, the second edition now, that you wrote about the experience of parenting and how hard that was in a way. I imagine it was very new and very intense. Did that in any way influence you also in your views of emotion?
Well, no, I think that's just part of the whole developmental process. I mean, marriage is difficult, parenting is difficult. Nobody tells you that, you're going to have all these intense reactions. And
even if they did, probably it wouldn't serve a lot.
Exactly. You don't understand it until you actually have to go through it. So, I mean, yes, it was important, the parenting part, but just as part of a whole developmental perspective. If I had remained an engineer and become a parent, I imagine I would have tried to be a controlling, and avoiding. So it's more just fed in.
Yeah. Probably feeling a lot more secondary anger or something like that. Are you working on something now? Some research project or something?
Well, I've retired, so I still have a few doctoral students, and we're working on task analyses, which I still think are the best way of doing research, of shame and of actually avoidance or interruption of emotion. So those are the two pieces of research that are still going on. And otherwise, we've just written a book on emotion-focused therapy of generalized anxiety disorder. So they're sort of more expanding into different areas. But otherwise, I'm not working on something specific.
And there's a supervision book also coming?
Yeah, a supervision book is just coming out, right? And there's a tape on supervision. Well, actually, next week, I proposed to APA to make a tape on working with emotion. So we're going, and there's going to be 3 approaches to working with emotion. So it's going to be emotion-focused, psychodynamic, and cognitive behavioral therapists. We're going to look at clips and talk about how to work with emotion from each perspective.
Taking what you're saying, do you think there's any psychotherapy topic that's seriously under-researched? Maybe you can make a list.
Yeah. Well, yeah, I think that the process of change is under-researched. There's just not very much research on how people actually change.
And you still propose utilizing, for instance, task analysis to try to...
Yes.
Well, I'm sorry for jumping between one thing to the other, but I'd like to play a game with you, if you didn't mind. I would like to say a few names that I know have some significance in your professional life. And I would like you to try to tell us, as briefly as possible, what kind of main lesson you got from this person. Is that okay?
You sure?
Yeah? Okay, I'm going to start with a hard one, because it's a big one. Carl Rogers.
Well, I think what he said sort of captured for me something that I knew intuitively about the importance of empathy and understanding and acceptance, and that acceptance was really central in helping people to feel safe and more comfortable. So, and I had a lot of respect for him. But then eventually I read after he died, his autobiography, his biography. And, I was a bit shattered that he was not as integrated a human being as I thought that he was. So that was interesting. But yeah, I did see he was a very significant image. I mean, I never met him in person.
Second person, Fritz Perls.
I never met him either, and I didn't like him. And a lot of the things that he did, but I mean, he was very influential. I studied his tapes intensively, and I think he was really sort of, I don't know, how much he was the innovator, but he put a whole lot of things together. So he made a very strong impact on my practice.
Yeah, on the theoretical.
It's not so much theoretical, but on my practice.
Yeah, in what way?
Well, like two-chair dialogues and present-centeredness. I mean, he wasn't really a theoretician with a coherent theory. That's why I say not theoretical.
Okay. And I imagine that telling Gloria to go sit in the corner isn't really emotion-focused style.
Right, right. And then I didn't like all the confrontational
Yeah.
frustration aspect of what he stood for. And then again, his biographies, he was not an easy man or a very kind-hearted person.
So what about Eugene Gendlin?
Yeah, his work made a big impact on me as a graduate student. So I would see his theoretical work as having been highly significant for me.
Mm-hmm. And Virginia Satir?
Yeah, I did a fair amount of training with Virginia Satir. She obviously influenced my view and development of the couples therapy, but she didn't make a big impact on me. I didn't sort of respond emotionally to her.
Mm-hmm.
I spent 3 weeks at an intensive training. My wife and I went there. So she had some influence, but not highly significant.
Mm-hmm. What about Michael Mahoney?
I mean, he was more of a colleague, so he didn't really influence me.
Mm-hmm.
It was more social political. I mean, joining with him and Vittorio was helpful and important. And so, I mean, I had discovered constructivism through Pasqualeone.
Yeah.
So, it wasn't sort of like there was anything that I learned from Mike, but it was sort of like we were comrades in arms.
Yeah. Go ahead.
I think I learned a little bit more from Vittorio Guidano.
Yeah.
He was a very complex guy, and I kept trying to understand what he was saying. But that was helpful.
Well, another colleague of yours, actually, I'm going to question Marvin Goldfried.
Yeah, Marvin has been very influential in drawing me into integration. And I always say that I learned to respect the role of practice in psychotherapy from him, that practicing things as a part of learning and of change, and that he really influenced me there. Yeah, and he's had an influence on me in other ways, conceptually.
Yeah, did he help you in any way to change your ideas about cognitive therapy?
Unfortunately, no.
Although he tried.
Yeah. But the thing about practice is how he influenced me.
Okay.
But just, I think his openness to integration was sort of like a model.
Okay. How about Marsha Linehan?
She hasn't had an impact on me particularly, but her notions of, a more structured way of dealing with so-called borderlines, has had an impact on the field. She's impacted me by the notions of emotion regulation in the regulation of symptoms and things like, taking a walk, go for a warm, having a warm bath, or putting ice on the back of your neck. So she's helped me to see that people who are extremely highly dysregulated need that kind of activity.
So more skills-based thing.
The skills-based thing. Because I'm not a great believer in skill training.
Yeah.
But I don't work with that kind of population.
Yeah, sure. It's interesting to me because I guess DBT had a big impact on many professionals in the 90s for its focus on emotion also. So I was very curious to know your reaction to that.
Yeah.
Mhm. Although you do approach it in a very different way, of course.
Yes, yes. I mean, she adopted the notion of primary and secondary emotion to some degree. But yeah, I mean, she didn't make an impact on me personally, intellectually or whatever.
I'd like to finish off with some of them that I think maybe did more. Laura Rice.
Yeah, I mean, she was probably the most influential, although there's somebody else well known, 𝗵cie𝘀𝘁𝗁, who was my Gestalt therapy trainer. But those two people, Laura Rice and 𝗵cie𝘀𝘁𝗁, so Laura was the most impactful on me. I mean, I came to her and she was my mentor and taught me about following the process, and she also impacted me at the level of the kind of research and studying the process of change. And then, I mean, of course, we were collaborators and colleagues. So I learned a tremendous amount from her about listening.
Yeah.
And she was an incredible listener, and the notion of the leading edge and helping people to process further. And then there was 𝗵cie𝘀𝘁𝗁, who was my Gestalt therapy trainer. And I learned a lot from him, and more about acceptance of what is, and change to be what you are, not what you are not.
Yeah.
And so he was there. And then 𝗵cie𝘀𝘀𝗁, who influenced me theoretically in a very strong way, and introduced me to the notion of schemes and the whole neo-Piagetian perspective. So those have been the three most influential people.
That's the top three.
Yes,
yeah.
Yes.
Your dialectical constructivist position comes a lot from that, right?
From 𝗵cie𝘀𝘀𝗁, yes.
Yeah.
Yes.
So, Les, I'd like to finish off with one question I've been asking everyone. And it's kind of curious because at the same time I know I'm going to ask this, but I know that advice is really not something to be trusted in a way, more the experience. But I'll ask it anyway. What is the advice you wish you would have received when you were starting out as a psychotherapist?
What's the advice? I think it would have been to practice being attuned to my own bodily sense, and to sort of develop and trust my non-conceptual aspect.
Your non-conceptual aspects.
Yeah, which means attunement to emotion, not necessarily the meaning of things, but to be sensitive to what's being felt before it has words.
Yeah. So being able to go back to experience in a way.
Yeah, yeah.
Okay. Les, thank you so much for this opportunity.
Thank you for an interesting interview. You seem to be well versed in what I've written, and
well, I try, but I hope we can still get you, even being retired, to come here to Lisbon and give us some training. And I know you've already done it, but more is never enough. So,
yeah.
Les, I'd just like to thank you again for all your contributions. It was really nice talk.
Good, thank you.